My name's Blair Brooke Weiss, and I'm a Communities That Care trainer. I've been working to support communities in implementing Communities That Care, or CTC as we call it, for about 12 years now. But I started out as a counselor working with kids on probation. Let me tell you a story about a couple of those kids. On the one hand was Joe. Joe was a really sweet kid, but he had a really hard time dealing with negative influences. And what happened to Joe is he was out with some of his friends, and they were getting into trouble. And when the police came, they handed Joe the gun. So Joe was the guy who got arrested. When I went to talk to his mom and visit their home, it was obvious she was a great mom. She had pictures of all of his brothers and sisters with their caps and gowns from graduating from high school proudly displayed on the mantle. When I went to visit his teacher, she had the same impressions about Joe that I had. He was a really sweet guy, but he was too easily influenced. What would have happened in Joe's life if instead he'd been part of a prevention program in late elementary school where he learned the skills to resist those bad influences, stay out of trouble, but still keep his friends? Maybe Joe wouldn't be on probation now. Okay, on the other hand, let's talk about Eddie for a minute. When I met Eddie, his two older brothers were already in prison. And when I went to find Eddie's mom to talk to her about how we could help Eddie stay out of trouble, it was really hard to find her. I had to talk to several people on the street, and I ended up looking in the basement of a deserted building, and she was asleep down there, 2 o'clock in the afternoon. Eddie was one of those kids that was really hard to change by the time I met him. He had so many factors stacked against him. But what if, when his mom was pregnant with her first child, she'd been able to be a part of a prevention program where public health nurses visit parenting moms and help them get through their pregnancy and their delivery of their babies? Maybe Eddie's life would have been different. What I did learn from that experience is that the best way to help those kids would be to get ahead of the curve for them. Help them to strengthen their own skills and also strengthen the communities, the schools, and the families that they came from in order to help them be successful and to stay out of trouble. That's why I got interested in Communities That Care. The Communities That Care process involves 5 phases. The first phase, Get Started, is where you do all the behind-the-scenes work to activate your community to begin the process. In phase 1, it's essential that key community leaders decide to bring Communities That Care into the community. They, in turn, invite a diverse group of stakeholders who care about children and youth to become involved. Phase 2, Get Organized, is where you form a coalition or a community board. Or if you have an existing coalition that's doing well in the community, you may invite that coalition to take on the Communities That Care process. You will learn about prevention science, write a vision, form work groups, and do all the initial planning necessary to take the next steps. Phase 3, Create a Profile, is all the assessment work in Communities That Care. First, you'll take a look at the data about the youth in your community in order to select priorities. What are the health and behavior problems most in need of attention? And what are the risk and protective factors for action? You'll also take a look at the resources in your community to find out where there's already things that are working well to support those priorities and where there's any gaps in services that CTC could do a lot to help. Phase 4, Create a Plan, is where you pull all this work together in order to write an action plan for your community's prevention work. You'll compile that assessment information and select tested programs and policies to address the priorities that you found and to fill those resource gaps that you found during your assessment. Phase 5, Implement and Evaluate, is where all your planning gets turned into action. You'll implement those tested and effective policies and programs. You'll deliver them with high quality. You'll monitor their progress to be sure they're being delivered well. And you'll track your changes over time to see that you're making the changes in children's health and well-being that you planned for. Throughout all of these phases, there are Communities That Care workshops to help you with each step. But remember, phase 5 is not the last phase, because Communities That Care is this continuous process of improvement. You'll revisit all of those phases over the years in order to continue improving the health and well-being of your children.